In this year's State of the County address, we are proud to recognize Mesa County's achievements and strategic priorities while focusing on collaborative partnerships that allow us to provide the infrastructure so that you can live the life that you want.
American Rescue Plan was really built around infrastructure dollars that were passed out to the state and local governments to help communities recover from the impacts of the pandemic. When we looked at this, we looked at it in the sense of the federal government put this criteria on it, and we also looked at it from, okay, where can we do the most good for our community within that criteria? That's how we came up with a project list. The list was then vetted and run by the commissioners and decision makers to see if they agreed, and we've come up with a great process to create these great facilities that will then be providing great community services. So the ARP process has been very involved. I think what the county has done with it, though, is good in the sense of we have moved forward quickly. These dollars need to be spent by 2024, and they need to be completed, all projects, by 2026. We're expecting to turn ground on a number of those projects this year, and some of them already have actually started. So we're wasting no time in getting these dollars out to the community, serving community function, and hiring contractors and various others as we move forward.
Broadband is everything. It's like electricity was 70 or 80 years ago. You absolutely had to have it because the world was going electric. Today, broadband, you absolutely have to have it because the world is going on the web. The FCC defined broadband as 25 megabytes download speed and 3 upload speeds. So if you have less than that, you're not considered to have broadband. Now, the gold standard is a gigabyte level of download speed, which is 1,000 megabytes. We're not even close to having the gold standard, but that's our goal here in Mesa County, is to eventually, maybe it takes a decade, maybe it takes 2 decades, but we would love to have everybody within Mesa County to have access to a gigabyte level of download speed so they have true broadband services. What that does is it not only attracts people to move into Mesa County, but also industry, because we do everything online. In-the-ground fiber is the absolute gold standard when it comes to broadband, and that's what we're looking for the most part. We're not going to be able to bring in-the-ground fiber to everybody in the county. That's just not financially feasible. But we want to get it to as many people as we can, and then from there, we can throw the signal to the far reaches of the county to make sure people still have access to that. Right now, we're working on a needs assessment for broadband. So a lot of people kind of think, well, where is broadband now? Where are there strong internet? Where is it weak? Well, we don't really know. A lot of those companies don't share that type of information, and so nobody really knows where we need to be. So we're right now investing in a needs assessment so that we can go out and we can pinpoint this area needs better internet. And hopefully we have that done this spring and we can start actionable steps towards our future that we want here in Mesa County.
We spent most of the last year assessing our mental health system here in Mesa County. We learned a lot and identified where our critical gaps are in the system. From that, we developed an action plan to help fill those gaps. One of the first gaps we're filling is with a mental health navigation hub. This is a place where residents can get comprehensive information about mental health services in Mesa County. And it's more than just a list of therapists or support groups. It will be a warm handoff to make sure people get the help they need. We've already hired the supervisor for this program and expect to hire 2 more staff in the coming months as we prepare to launch this new service. Another challenge we identified were people who frequently rely on our law enforcement and hospital emergency departments for non-threatening health emergencies. In fact, in April of this year, 49% of the people in our jail were on some type of an antipsychotic drug. And we believe that if these individuals can get the help early on, before they reach crisis, we can keep them out of our jail, out of our hospitals, and they can continue to be contributing members of society. So we're about to launch our intensive case management program, where individuals who are referred to this program will have the care they need to address their mental health illnesses and avoid crisis. We received $400,000 from the Office of Behavioral Health and additional commitments from our sheriff and St. Mary's Hospital, which will allow us to have a robust program. This not only helps those individuals in the program, but it should free up our system to be able to help others who are often on a wait list. Other areas we're working on include telemedicine within our EMS system to provide medical clearance for individuals needing to access behavioral health services so they can avoid the emergency rooms. We're also looking for ways to expand school-based clinics, such as the one the Marillac Clinic operates at Central High School. And we know that whatever we do, we know having adequate staff is a challenge. Across the board, it's a challenge. So we're looking at ways to support the use of paraprofessionals, peer specialists, and unlicensed practicums under supervision to help fill those gaps.
This has been an exciting year for sense of community and sense of pride in Mesa County. Years ago, 40 years ago, a promise was made in Mesa County to build community centers, a place for family gatherings throughout our county. In our county, we have more population that lives outside the city areas or the community areas than we do that live inside the city limits. We've come up and we're beginning, and on here are the 4 community halls that we're adding in addition to the other 2 that we have. And in Quebec, we've actually purchased the property and we'll begin construction forthwith. At our Clifton area, we've got our community center. We'll also begin that construction. We hope to have those 2 community halls completed yet this year. So it's an exciting time countywide, not just inside the city limits, but outside the city limits, whether it's being in Clifton or down in Loma, Mac, Quebec. That's a promise made, and finally, after 40 years, we're going to make sure that it was a promise kept.
Department of Human Services is able to provide for the basic needs for our community, and by doing so, it elevates the entire community. And we don't do that alone. We do that with our partners. We have opportunities to provide grants for other people and organizations out there who are providing services as well. Our goal really is to ensure that there's safety, stability, and meaningful employment. We do have what's called the RUN grant at the Workforce Center, where we are able to help people get certified in those industries that have a really high need. We can help them with more education to further their career while we're helping the industries. You can go through the Workforce Center and get those certifications for free.
People know about what we do as far as disease surveillance. We track new diseases and we track their spread, and we try to prevent that spread of those diseases. When COVID's over, we'll continue to do that. There are a list of about 50 things that are considered reportable diseases. So when those show up in our community, we're notified, and then we put a team out to make sure that those diseases don't take hold and spread rapidly. Every 3 years, we conduct a community health needs assessment, and we do that in partnership with all of our hospitals. And so what drives my agency are the results of that assessment. You know, there are various things that become gaps, and so my team goes out and tries to work with the community to address those gaps. And those really are about quality of life. It doesn't have to be about, regulations and rules and things like that. It's about the overall quality of life of Mesa County residents. And what we find most is that a lot of it has to do with socioeconomic status. So we try to do everything to lift everyone up so everyone has the same opportunity to succeed. Public health is not only about physical health and mental health, but it's about the economic health of a community, and you have to keep that balance. And so, I want our residents to know that we're not just out here trying to implement certain rules and regulations because they're health only related. We've done a good job of keeping the balance in the community, and I think everyone's been appreciative of that.
We are proud to recognize Team Mesa's hard work and dedication, who consistently strive for the county's success. Stay updated with what Mesa County is working on and our services by visiting mesacounty.us. Thank you, Mesa County, for helping us make decisions that support our community.